So in over 4 decades since the AIDS epidemic burst onto the global scene, it's killed more than 42 million people, while AIDS-related deaths have been steadily declining, falling from 670,000 in 2022 to about 630,000 last year. The numbers, as you can imagine, are still dizzyingly high. UNAIDS chief Winnie Byanyima pointed out in her report released yesterday that a person dies from AIDS-related causes every minute, warning that, in fact, the world remains off track to reach the ambitious goal set for 2030. For more on how we're doing, let's bring in the Director of Rural Health Advocacy Project, Russel Rensburg, who's with us via our video link this morning. Russel, lovely to see you. Welcome to the SABC News Channel. Always great speaking to you about these important health issues. I wonder if you can just begin by helping us distill through the main takeaways from this report. I mean, on the one hand, we're hearing that there is progress because new infections are on the decline. But on the other, we're hearing that we're still incredibly off track if we are to reach the ambitions that are set for 2030.
Yeah, look, I think that's probably what this report is about. We've had incredible progress, and victory is in sight, but there are significant things standing in the way. And I think one of the biggest challenges is the funding and the resourcing of the response. You know, with global development partners all looping back in terms of their commitments as they face domestic crises. And then the other issue is obviously the over-indebtedness of nations, which will have a significant impact on how the HIV response is funded going forward. Right, but I think this is a really good report showing that collaborative action can lead to results. As you indicated, between 1996 and 2003 in South Africa alone, millions of people died from HIV. And today, for over 77% of people who know their HIV status to be on treatment, we've made significant progress, but we still have some way to go.
Yeah, and the sense I'm getting, and I'm sure this point has been made multiple times, is that addressing this issue is an intersectional, or needs an intersectional approach, right? You cannot really make any kind of meaningful progress without speaking to some of the socio-economic issues that burden people who need treatment. And I suppose with that in mind, it comes as no surprise that it's mostly Eastern and Southern Africa that are still amongst the most affected regions.
Yeah, I think, well, the story this year is that, yeah, we are the most affected region and we will be, right? You'll always have HIV regardless of when you're on treatment, and our prevalence levels are amongst the highest. But we've made good advances in access to treatment. We've made good advances in retaining people in care. And I think the areas where we need to grow now is in what they call key populations. And that really means you need like differentiated approaches for high-risk groups, particularly adolescent women and young girls, key populations like men who have sex with men, injecting drug users, and so forth, right? And I think we have the technologies and the tools to do that in a more comprehensive way now. So there is hope, but it's still very expensive. But overall, I think we have a lot to celebrate. People are living longer. We're probably having to look at more integrated responses to the health of people living with HIV, because it's not a single disease issue. You know, our own national strategic plan talks about strengthening mental health care responses for people living with HIV and TB, right? So I think we've really achieved a lot, but there's a lot of different things that we need to do now, and we need to mobilize around that, particularly expanding social assistance.
Do we understand a bit better why those who are in high-risk groups form part of those groups? I think you mentioned adolescent women. I mean, does it come down to lifestyles that they live, a lack of education, perhaps a mixture of all these issues?
Look, I think it's a mixture of these issues, and economic vulnerability is probably a big one, particularly for young adolescent girls and young women, right? I think the nature of how we respond to HIV has also changed. Right, and I think in some ways, because we've passed the crisis, and I say this under advisement, right? Maybe our attitudes towards HIV prevention is not the same. Condom use amongst young people is down, right? And those barrier methods are a significant mechanism to stop the transmission of HIV and AIDS. But we do have new technologies now, like pre-exposure prophylaxis, right? PrEP pills that people can access, and if taken regularly, reduces the risk of actually contracting HIV. And just recently, we also heard that South Africa has accepted a donation for the landmark HIV prevention injection, which you've taken every 2 months. can actually reduce the risk of contracting HIV amongst young women by 95% or 99%, but it is very expensive. So I think there's lots of different technologies, but as you said, we have to look at the underlying social structures that make people vulnerable.
Right. The United Nations has said something which I find is very interesting, something along the lines of political decisions that are taken this year will have a major bearing on whether or not these targets are reached by 2030. And I wonder if you can help us decode that. I mean, I suppose for somebody in your field, it's very easy to connect the dots about how political decisions may ultimately cascade to what happens on the ground. But what exactly are we referring to here?
Talking about funding, right, primarily, right? I think there's a number of different, depending on where you are, right? One of the big things is obviously debt and debt cancellation or restructure. Right? A lot of countries in Eastern and Southern Africa are paying larger amounts towards debt servicing, which is reducing the amount of money that they can spend on their local responses, even as the world is asking them to increase local commitments. The second thing is the global financial architecture around donor funding. PEPFAR, one of the leading funders of the HIV response in the continent or in Eastern and Southern Africa, hasn't yet been confirmed. And a lot of that will be dependent on which political leaders are elected in the US, right? And I think lastly, it's also really just thinking about how we reorganize our care systems. In South Africa, for instance, the national health insurance and the decentralization of care to the local level could have a massive impact on strengthening the response, particularly to these targeted groups in an integrated way. So those are all political choices. And I think if those decisions are not made in the right way, it could have a negative impact on this final journey towards ending AIDS as a public health threat.
Yeah, and I think you've mentioned that we are past the crisis, something you said is an advised statement that you're making. Help us understand what that means, ultimately.
Look, I think when you look at effective coverage, right, it's like when enough people are covered by an intervention for it to have a population health impact. Currently, the UNAIDS targets are 95, 95, 95.
Right.
Right? So 95 of people living with HIV know their status. 95% of the people who know their status are on HIV treatment. And the last 95 is that 95% of those in treatment are virally suppressed, meaning that their viral load is undetectable and untransmittable. So in essence, they are no longer an HIV risk and they're living longer. Where the challenge comes in is that even though we're at 77% in South Africa, it ranges between 65 and 70% of people living with HIV on treatment, we still have a significant amount of people who are not on treatment. The problem is that we're not seeing the deaths are reducing. And as the deaths reduce, the public support or commitment to these issues wane. And I think that's kind of where the balance is. We are at the point where less people are dying. We are at the point where infections are decreasing. We are at the point where we're near elimination of mother-to-child transmission of HIV to babies, right? But we're not really done, right? But it's like almost being at the front of the queue, but not quite at the teller yet. And I think that last stage is when we need to have the strongest commitment. And that's where we are right now.
Interesting. Russel Rensburg, as always, appreciate your time. Thanks very much indeed for speaking to us. Russel is, of course, the director of the Rural Health Advocacy Project. We appreciate your time on the SABC.